One of the other features that we have here at Newman Regional Health is we do have a new Da Vinci robotics system. Both myself and Dr. Bitter and Dr. Harris have been trained using the robot system, and so we're able to offer surgeries that we were not previously able to offer at this facility. Larger colectomies, hernia repairs, even robotic G-tubes for patients who need to have feeding tube access, cholecystectomies that really, one, give us the benefit of decreasing pain postoperatively for our patients, but also just giving us better visualization as surgeons really helps us to provide better care for our patients.
We're now offering robotic surgery in a smaller area where you won't have to leave this community to a bigger area that you may not be comfortable with, and it's not necessarily necessary that you would need to. I would call this almost like a one-stop shop for a lot of operations that we offer here. Myself, Dr. Douglas, Dr. Turner, Dr. Harris, we're doing a lot here. Not just small run-of-the-mill hernias or gallbladders, but we're starting to take on colon resections and hiatal hernias. And that's I would say, the beauty of what we're able to offer with robotic surgery.
When you come for your surgical procedure on any given day, after you've passed through the registration department, you will be greeted by a preoperative nurse who will take you into your same-day surgery room for the day. Once you arrive there, they will have you get into a patient gown, and they will begin asking questions about your medical history and medications. After that, they will start your IV and give you any type of medications that the surgeon or anesthesia provider might have ordered for you. An anesthesia provider will come in and ask you some questions regarding medical history, surgical history, anesthetic history, and also allow you an opportunity to ask them some questions about your anesthetic that day. Your surgical nurse will come into the room and ask you a few questions as well regarding your procedure and answer some of your questions about maybe what you might expect for the day. The surgical nurse will take you back into the operating room, and the procedure will begin once you are asleep. During your procedure, it's important to note that there's a whole team of individuals that will be working with you and with the surgeon. There is a minimum of 4 individuals in each surgical procedure.
One of the reasons I think that people come to Newman Regional Health is because it's a smaller hospital. If you go to Wichita or Topeka, while those are wonderful facilities to go to, you don't get the small town feel that where you in a smaller hospital really get that one-on-one attention that you don't get in larger facilities. The ability to get patients in quicker for surgeries, for scopes, for appointments, I think is one of the really big reasons why patients want to come here rather than waiting for a month to see someone in a larger facility. And I know I pride myself on trying to get my patients in as soon as possible, especially for the more acute patients. If one of my patients calls and says, "Hey, I'm hurting, doc," I try to get them in that day, or at the very latest the next day, which is a lot harder at a bigger facility. So I think that's a huge benefit to Newman, that we have that small hospital feel and can really give that direct patient care that a larger facility could not offer.